history on what is this Rome thing? What is it? My understanding is the first convention or the meeting happened in Rome about this topic, and then from there Rome 1, 2, 3, 4 started happening. Give us a little historical background. How was it ignored, or how was it treated in the past, and what has changed in the last few decades?
Yeah. So, IBS is not new. Actually, I talk about this in the book as well. Even Romans, Greeks, even in India, we knew about IBS.
Raw food is processed differently than cooked food in the gut, right? So by processing, how our body processes raw food versus cooked food. Of course, our Paleolithic ancestors ate more raw food before the processing happened in human civilization. So tell us about for IBS. Mm-hmm. How do you balance it? What kind of ratio do you recommend, raw food versus cooked?
I don't recommend raw. We did the Mount Everest base camp, and I'm more of a runner than mountaineer. Okay, running is my main passion, and then I do cycling, I do trekking, and all that. But I am an avid marathoner. Because I run so many marathons, I'm already physically reasonably fit to try other adventures. So it's easier for me to do other adventures. So if there is a friend who is planning Mount Everest or Kilimanjaro, I just join them because I'm already sort of prepared for.
Welcome back to the podcast, Becoming Free Now. We have an amazing physician and author with us, Dr. Sripathi Kethu. Dr. Sripathi Kethu is a gastroenterologist based in Dallas. He had written an amazing book, very popular, getting rave reviews. It's called IBS Guide. A very important topic. We'll get into why it's important, why it's difficult to treat, and what treatment options we have. IBS Guide, Irritable Bowel Syndrome Guide, explored the mind, gut, microbiome, and a holistic approach to conquer IBS. Dr. Sripathi Kethu. And very interestingly, he's also a polymath. He has multiple talents. Of course, he's an expert in one area, and he has touched upon many other important areas of life, which includes literature and health. Most importantly, he's an avid athlete. Let me give you a very interesting side of his life. Outside of his professional life, he's an accomplished athlete and avid outdoor enthusiast. He has tackled many challenges, including trekking to Mount Everest base camp, and he completed a 100-mile bike ride, and he had also taken part in a 150-mile MS bike rides to raise funds for multiple sclerosis research and support. He's also a passionate runner and completed marathons in all 50 states of United States and all 7 continents, including Antarctica. He even earned a highly coveted 6-star Abbott Major medal for finishing all world marathon majors. That's not a simple accomplishment. Set aside the book and the gastroenterology and 10 years of successive best physician awards and things like that. And this side is quite amazing. So Dr. Kethu, congratulations on the book, first of all, and congratulations on finishing all these athletic marathons and is something that is not possible for common mortals. So welcome to this channel.
Thank you, Dr. Kurapati. Thank you for that kind introduction.
Yeah, so I will, you're welcome. I'll jump on with the IBS topic, and then we'll go into your personal interests and the importance of athletics in life, right? So it's not just a passion, it's very important for all of us to be physically active, change our lifestyles, focus on our diet and things like that. So IBS Guide, just within 1 month of its publication, it has garnered hundreds of great 5-star reviews. If you have any GI problem, I'd recommend this book, regardless of whether it's IBS or not, because we don't know whether somebody has IBS or not. I think it's majorly undiagnosed, one of the GI problems. So let me go over the table of contents for the listeners here, so you know how Dr. Kethu wrote 300 pages on just one topic, about GI health. So the definition and overview, the history of IBS, the prevalence of IBS, risk, and why is it important for our life? What are the common symptoms? What are the physical signs? What are the associated conditions associated with IBS? And he titles this chapter, "The Tangled Web of IBS Causes," the gut-brain connection, gut microbiome, the immunity, leaky gut, food sensitivities, role of hormones in IBS, how do you diagnose it, what are the criteria that we use, and then he concludes it by holistic approach, dietary changes, and mind-body connections. And he gives a lot of complementary and alternative treatments. Highly recommended book. Please go ahead and download this book and start changing your life for better. So, Dr. Kethu, tell us about IBS. It's a functional gut disorder, right? So what is a functional gut disorder?
So yes, functional bowel disorder is, now the new term is disorder of gut-brain interaction, DGBI. Functional bowel disorder was the old term, we still use it. Basically what it means is when you have symptoms of different GI symptoms, but you cannot find a specific cause or nothing wrong with your body. For example, if you take pneumonia, you do a chest x-ray, you see the pneumonia. If you are having a heart attack, you do an EKG, blood test, it'll show up on these tests, not only the symptoms, but you can actually see some what we call objective data. But here, what we feel is only symptoms, more subjective, where you feel the symptoms would include, for irritable bowel syndrome, it is abdominal pain, then bloating. Either you may have diarrhea, constipation, or you may alternate between diarrhea and constipation. In spite of having all these symptoms, when you do any test, for example, blood test, it doesn't show. If you do colonoscopy, CT scan, everything is normal. That's why it's called functional, meaning there is nothing anatomical wrong with you, but just your function is disordered. That's why in the past it used to be called functional bowel disorder. But now with better understanding of this condition, now we call it disorder of brain-gut interaction, because that's what is wrong with it.
So is it more like a diagnosis of exclusion, where you start looking for, okay, it's not celiac disease, it's not an intestinal infection, it's not tumor, it's not bleeding, it's not whatever, so you start looking. So tell us when somebody comes with, what are the common symptoms? When somebody comes with, when do you suspect IBS? Is it? Go ahead.
So basically, IBS, it's somewhat diagnosis of exclusion, but we are moving away from calling it a diagnosis of exclusion, meaning in the past, we used to say that you rule out everything. If you can't find anything, you label the patient as having IBS. So it's almost like a garbage can term where you lump all the GI symptoms that you can't explain and you call it IBS. But that has changed. Now there are a set of criteria, they are called Rome criteria. And there are different iterations of Rome criteria. Now we're at version 4 that was released in 2016. So if you meet those criteria, if you have, for example, 12 weeks of symptoms, abdominal pain, then change in bowel habits, then bloating, and if you have it at least few days a week for 12 weeks, then you meet the Rome criteria for diagnosis. Then you look at other variables. What is the age of the patient? If they have any red flag symptoms, that is the most important thing. So let's say if someone is above 50, because IBS is generally a young person's disease, although it can affect you any time of your life, it starts in your 20s and 30s. So if a 20-year-old comes in with abdominal pain, diarrhea, bloating, and all that, we don't have to do $1 million workup. We don't need to do every test under the sun. As long as they meet the criteria, they don't have any alarm symptoms or red flag symptoms, which would be bleeding, weight loss, fever, anemia. So you do very basic blood tests and set of symptoms, then we can make a diagnosis. But on the other hand, if there is a 50-year-old comes in, never had any GI issues, all of a sudden they have diarrhea, abdominal pain, we cannot say that, okay, they meet wrong criteria, so they may just have IBS. You need to do more testing. That might involve doing a colonoscopy or a CAT scan if they have weight loss. So we arrive at a diagnosis based on not only the symptoms, but other associated symptoms and age of the patients, and so many different things we look into, take into consideration.
So is it more common in males or females?
Females are more common. It's 2 to 3 times more common in women. Yeah. So that's partly, there is a lot of research going on in why women are more prone to have it. I think one of them is hormones, for sure, especially around menstrual periods. Some people may have more symptoms. Pregnancy can affect IBS. Menopause can affect it. So some of it is hormones. Some of it is anxiety, depression, slightly higher rates of stress, all that. That's why women are more prone to have it.
Okay, very interesting. So when a young man or woman starts to develop these symptoms, so this you call the gut-brain dysfunction, right?
Yes, disorder.
Disorder. When you look at, for instance, Ayurvedic physicians talk about the importance of gut in human in metabolism or human biology. So, because what we eat is processed by the body, right? So, and then the process, and then it's absorbed, and everything happens within the gut. So I will come to the treatment and the reasons for the irritable bowel syndrome, but give us a little history on what is this Rome thing? What is it? My understanding is the first convention or the meeting happened in Rome about this topic, and then from there Rome 1, 2, 3, 4 started happening. Give us a little historical background. How was it ignored, or how was it treated in the past, and what has changed in the last few decades?
Yeah. So, IBS is not new. Actually, I talk about this in the book as well. Even Romans, Greeks, even in India, we knew about IBS symptoms for a long time, for hundreds of years. So even Egyptian in their, medical book, like thousands of years ago, they mentioned about symptoms that are consistent with IBS. But there was no name even until 1950s and 60s. So coming back to 1900s, William Osler is one of the physicians who, father of modern medicine, who first described this IBS, but he called it mucus colitis because people had this diarrhea, mucus in the stool and all that. He called it mucus colitis. Some people call it nervous colon. Some people call it colitis, although there is no inflammation there. They called it colitis. So people came up with all kinds of names for the same condition. So to refine the diagnostic criteria, because everyone comes up with their own name for it and there is no set criteria, 1990s is when experts in GI, functional bowel disorders, experts in functional bowel disorders met in Rome in 1992, and they came up with criteria. And then over the years, in the past 40 years, there is so much refinement of the criteria. So there is, now the criteria is even more refined in terms of the duration of symptoms, excluding alarm symptoms. In the past, that was not the case. So as we understand the condition better, we refine the criteria and Now we can diagnose IBS without a doubt in most of the cases. So that is the history. Although we have known it for a long time, now we have a definite name for it. And also, as we understand better, now we divide it into four different categories. There is IBS-C, which is a constipation predominant irritable bowel syndrome, where people, they have abdominal pain, but more constipation. IBS-D, which is diarrhea predominant IBS. Then there is mixed IBS, where you alternate between diarrhea and constipation. And then IBS-U is undefined. They have abdominal pain, bloating. They have vague symptoms. They're all lumped into IBS undefined.
So we know that intuitively we know about the nervous gut thing, right? So before an exam, before a board exam, or before a speech or a talk, or you go before crowd and talk, we know that your bowels move more frequently, or you may have upset stomach and so on, and then that goes away after the stressful event or stressful stimuli is taken away. Is this a serious version of that, or at what point you start saying that this is really worrying me, this is something that needs a diagnosis and a treatment? So at what point you say this is a serious, or I don't know how I'm using the word serious disorder, but how important this is. So
Sure.
At what point in the transition from a nervous gut to IBS, where do we draw the line?
So nervous gut is one of the components of irritable bowel syndrome. That's why we don't like to call it nervous gut anymore, because that's one of the many reasons why people have IBS. Now, coming to the causes of IBS, irritable bowel syndrome, there are multiple causes. One of them is having visceral hypersensitivity. That is having a sensitive gut or nervous gut where it reacts to any type of stress. So we need to talk about enteric nervous system here, because that's a very complex web of neurons in our gut. That's why we call it second brain, because it's as complex, if not more complicated or complex than our own main brain. That's why it's called second gut. It has 500 million neurons, and it constantly communicates with the brain. So when there is any problem in the brain, for example, stress, that can cause the problem. So that's why it's called nervous gut. When you're nervous, your gut will react. For example, if before a major game, or if you have a test, you might run to the bathroom. That's because your brain is sending the distress signals to your gut, and gut starts reacting. Your nervous system, your enteric system is reacting. So having nervous stomach is only one component of the IBS. There are so many other things. Microbiome, if you have disordered microbiome, which is called dysbiosis, you can have symptoms. So just if someone has to run to the bathroom when they're stressed, we cannot call it IBS. So going back to your question about when do you diagnose IBS? So again, they need to have more than just running to the bathroom when they're stressed. So again, they need to meet the symptom criteria. Okay. And they have to be consistent on a regular basis, rather than one-off kind of situation where anybody can have some bowel issues just because they are under stress.
So now coming to what triggers or what causes it? So I know there are so many factors. So I would like you to kind of take us over, one by one and see, because people eat certain types of foods not knowing that they are causing those type of foods or lifestyles are causing their symptoms, but they take this medicine without taking away the offending agent. So tell us about what causes IBS.
So other than some of the things we discussed, one, we talked about having this visceral hypersensitivity, anxiety and depression, or childhood.
Let's dive in a little bit on visceral hypersensitivity. You talked about enteric nervous system. and visceral hypersensitivity. I think that's an important thing because most
Yeah,
people think that everything happens up here, and this is what happens here is a consequence of this. But then there is a two-level bi-way communication that happens. But so tell us about
exactly.
the enteric nervous system and visceral hypersensitivity.
So basically, if you go back years ago, like 50 years ago, there is a man by name William Gant. He's an American physiologist. He worked with Pavlov, Russian scientist who discovered Pavlov's reflex and dog experiments and all that. Gant took it to the next level, and he did some experiments to see if there is any connection between brain and gut. What he found out is very interesting. He created a pouch in dogs, and then when he showed food, just looking at the food, the gastric secretion started coming on into this pouch. So when brain is thinking about food, just stimulation or the smell of the food, your gut is reacting and it's producing acid. Then he took it to the next level, and he put dogs into some stressful situations, and then the gut will start reacting even to the stress. It doesn't have to be it doesn't have to be smell or taste of the food or sight of food, just the stressful situation, loud noise, the gut started reacting. So that's when he may establish the connection between brain and gut, that whenever the brain is under stress, your gut will start reacting. And then, World War II time, people did experiments even then. People who went through a lot of trauma during World War II, for example, who went through, rationing, homelessness, violence and all that, later on, they became very sensitive. The guts became very sensitive because the brain has this memory of trauma that made the gut to be very sensitive. So years later, many of them developed IBS. So again, there is a connection between brain having stress and then gut becoming more sensitive. So there are a lot of situations that can make your gut very sensitive. That can be life issue.
Sure. Sure. And the other way around, the food that we eat might change the gut, say microbiome and the contents of the gut, and then that can send signals to the brain, causing depression, causing things like that, and then it's just a vicious loop, keep going on. So
that's why I call it happy brain leads to happy gut, and the other way around is true too. So you're absolutely correct. If there is any stress in the gut itself, that includes dietary sensitivity. Even if you don't have any sensitivity, if you eat poorly, if you have a lot of refined sugars, a lot of dairy, some of the vegetables, meats, so many processed foods can create a lot of gut stress. And when there is all that gut stress, that can affect your brain too. It can increase the anxiety rates, depression rates. That's why people with irritable bowel syndrome, about 60% have anxiety, about 30% have depression, because it's the two-way street. Whether anxiety and depression caused IBS or IBS symptoms caused anxiety and depression, that's hard to tease out, but that's like chicken and egg. I think they coexist, but just the fact that two separate disorders, one belongs to gut, the other one belongs to the brain, they're so interconnected, there is so much overlap there. That's why, each one affects the other. Not only the diet, but microbiome, huge research going on. I think now everything is connected to microbiome. So even mental disorders now, psychological disorders, whether it's anxiety and depression, if you have bad gut microbiome, that can lead to a lot of psychological problems.
And that's why it's called biopsychosocial disorder, right? So
yes.
Biopsychosocial disorder, because it's a complex situation where there is no you need a multi-pronged approach to solve it, right? So you need biology, you need psychology and social environment to handle this. So we'll come to that in a moment, but talk about lactose intolerance and IBS. So you mentioned about having excess dairy, having excess refined carbs, having meat of
Just meat, yeah.
So lactose intolerance versus IBS. Is lactose intolerance a part of a bigger spectrum of IBS? So tell us about that.
They're two separate disorders. Both are common. They can coexist just because both are common, but they are two different disorders. Lactose intolerance, obviously, when you have decreased level of lactase enzyme in your digestive system, you cannot digest milk products where you can develop lactose intolerance. In certain populations, it can be as high as 60 to 70%. For example, if you take African Americans, Mediterranean descent, even among Indians, lactose intolerance is very high. And as we get older, more and more of us develop lactose intolerance. We have less and less capacity to digest milk. So with lactose intolerance, you can have symptoms similar to irritable bowel syndrome. You can have abdominal pain, diarrhea, bloating, and all that, but it is separate. Sometimes it's hard to tease out if you just have lactose intolerance or if you have irritable bowel syndrome. But it's easy to recognize whether you have IBS or not. One way to know is, especially if they're in the high risk group, if I see a patient who I think has IBS, but let's say if they're African American descent, I might just recommend, okay, before we do any test, let's just try lactose-free diet for a couple of weeks, especially someone who eats a lot of cheese, ice cream all the time. I just tell them to stay on lactose-free diet. There are some tests you can do to diagnose lactose intolerance, like a breath test, but we don't even need to do that. It's simple to just go on lactose-free diet for 2 weeks, very easy to do. And if they feel better, then you have a diagnosis.
So lactose comes in what products? Milk, cheese?
So for four major categories, obviously milk, ice cream, these are the two major sources of lactose. Then cheese, then yogurt. Okay. And you can see, you can find lactose even in butter and other things, but that's not a major source. So when I tell them to go on lactose-free diet, usually milk and ice cream are the major sources.
So tell us about the yogurt part, because yogurt it's a fermented product, right? So it's a fermented product of milk.
Yeah.
And then it's been recommended because it has probiotics and other things. So do you still recommend fermented yogurt for people who have lactose intolerance, or you go on a complete 100% elimination diet and see? And usually the way elimination diet works is you eliminate and then you reintroduce, right? So you eliminate it and then you slowly reintroduce and see if they can tolerate at least some of it or most of it or all of it. So what do you recommend about yogurt? Because I'm not talking about the yogurt that is out in the market, because it is a processed food. You don't know what's in it. It has added sugar, added preservatives and things like that. But I'm talking about the yogurt that you make at home. And, I'm from India, you're from India. We make yogurt at home. We don't add flavors. Usually we don't add flavors to it. The only thing we do is we pick the kind of milk that you make yogurt. Is it a whole milk or 2% or fat-free milk? The more fat milk has, the thicker and tastier the yogurt gets. So tell us about the yogurt. Tell us about the yogurt, importance of yogurt for human gut.
I think there are a lot of benefits in eating yogurt, especially homemade yogurt, whether it's Indian families, there are a lot of different, cultures where they make homemade yogurt. If it is not processed, there are benefits. So going back to lactose-free, if I tell a patient to go on lactose-free diet, I tell them to avoid everything that has milk in it, including yogurt, because I don't want to have a confusion if they have symptoms. Is it really lactose intolerance, or is it because they are on dairy? That's why I tell them to go 100% lactose free
for diagnostic.
For a diagnostic purpose. If they feel much better, like I said, like you mentioned, we don't, we slowly reintroduce some of the foods to see how much they tolerate. That's for lactose intolerance. But in general, yogurt has benefits, especially probiotics. So the probiotics are sensitive to gastric acid. So when you eat yogurt, not all the probiotics will go into your small intestine to benefit you, but there is some amount of probiotic that will make it into the gut, and it'll help with the, improving the gut microbiome. So there are a lot of benefits as long as it's not processed, not a lot of sugar, all that. There are benefits to it.
Yeah, that's great. So lactose intolerance and IBS and the gut brain and the FODMAPs. So tell us about the FODMAP. Tell us about the FODMAP for those of us who are not familiar with it.
Yeah. So, when we manage IBS, it's like a team sport. We cannot just use medication. We cannot just do, okay, go exercise, stress relief, and that'll fix your IBS. Diet is a major component. That's why I call it holistic approach, because we need to address different things. And diet is one of the most important things when we manage any gut disorder. It doesn't have to be IBS. So that's why this book, although it's written for people with irritable bowel syndrome, there are a lot of people with other gut disorders or any stomach issues. They'll benefit from it because there are a lot of dietary tips to improve your diet so that it'll improve your overall health. So coming to FODMAP, it stands for fermentable, FODMAP, fermentable oligodisaccharides, monosaccharides, and polyols. So all these are carbohydrates that we all consume on a daily basis. So these all ferment because they don't digest very well in our gut. So that's why these are fermentable foods. When you consume these foods, because they don't get digested well in the stomach and small intestine, they reach the colon undigested, and then bacteria act on them. And then it produces gas and it can cause diarrhea, all that because they are not digested well. So, for example, let's talk about oligosaccharides. Oligosaccharides are, there are fructans. Fructans are, you find them in wheat products, rye, barley. You can find even in garlic and onion. Those are oligosaccharides. Then there are disaccharides, which are milk products. We talked about dairy. That is the main disaccharides. Then you have polyols. Polyols are like sorbitol, xylitol, all the artificial sweeteners. Okay. And then we missed monosaccharides. Monosaccharides are different sugars in our diet. There are different foods that have monosaccharides too. So, for example, bread is one of them. Wheat itself, it has oligosaccharides and gluten that can cause problems. So these are FODMAPs. And when you consume these foods, people have more symptoms. And this is probably a low FODMAP diet is probably the most researched food that helps the IBS the most. So it was introduced by Australian researchers in 2005. They published some study showing that it helps people with Crohn's disease in 2005. So when they presented the data, people looked at it. It was for the first time anybody talked about dietary therapy for gut disorders. In the past, we knew about gluten-free diet, lactose-free diet, but we never knew this set of FODMAPs that can cause so many symptoms. And then in 2010, for the first time, they published a large-scale study showing that decreasing the FODMAP intake will improve the gut symptoms. And we use this all the time in almost all my patients. Everybody is recommended to have FODMAP diet, meaning cut down on the FODMAPs.
So I should have started with the holistic approach to it. In that, so you mentioned about the holistic approach to managing IBS. In that, diet would be one of the factors. So let us stick to that kind of a map. So in this diet FODMAP, so give us some examples. So what do you, before I go into that, we talked about lactose intolerance. Tell us about the gluten sensitivity, gluten food diet or gluten-free diet. So is that a separate thing, or is there an overlap with this? So when you start eliminating all of this, I wonder what is left. But anyway, so.
Yeah, there are two categories. When you talk about gluten, there is celiac disease, then there is non-celiac gluten sensitivity. So these are two different things. The overlapping condition is non-celiac gluten sensitivity. So let's talk about celiac. That's very straightforward. About 1 to 2% of the entire population has gluten allergy, where it's an autoimmune condition where they have real allergy to gluten. That is celiac.
Gluten is a product in.
It is a protein that in certain grains, especially wheat, rye, and barley. These are the three grains that have gluten. It's a protein in those grains. And people with celiac disease have allergy to this gluten, where they have damage to the lining of the small bowel, and they can have not only GI symptoms, but they can have malabsorption, where they don't absorb the nutrients because the villi are lost, brush border of the small intestine where all the nutrients get absorbed. People lose that because of inflammation. It'll become flat, so you don't absorb all that. That is celiac disease.
And then that causes symptoms.
That they can cause exactly the same symptoms, GI symptoms, but they have not only GI symptoms, but they can have vitamin deficiencies because they are malabsorbing. They're not absorbing the nutrients. So they're more prone to have osteoporosis. They can have other issues related to malabsorption of vitamins. So that is celiac disease. Easy to diagnose. There is a blood test for it. If it is positive, there is 90% likely that you have celiac disease. If we want to confirm it, we do a small bowel biopsy by doing endoscopy. That's straightforward. But there is another section of patients where they have symptoms every time they eat gluten, but they don't have the positive celiac antibodies. These are the people who have non-celiac gluten sensitivity, where they react to gluten, but they don't quite have allergy to gluten.
And the way you diagnose that is by elimination of gluten.
Elimination. So we need to tease out. There are two things. When they say that, when I eat wheat products, bread, pasta, and all that, I have symptoms. We need to really see, is it the gluten that's causing the symptoms, or it is the fructan, which is part of this FODMAP. Fructan is the oligosaccharide we talked about earlier. So wheat has both fructan and gluten. We don't know which one is causing it. So people label themselves as, I can't eat wheat, so I have celiac. Then what we do is we do a test, tell them that, because the test is negative, you do not have celiac disease, but it doesn't mean that you should not eliminate gluten, because eliminating gluten may still help you, not because you're eliminating the gluten itself, but the fructan in the wheat products. So that's what that overlap condition comes, where they can have IBS symptoms because of the sensitivity to fructan or the gluten, but they don't quite have celiac disease.
This is interesting, because teasing out between the fructan versus the gluten becomes important, because then you can recommend which diet to avoid, which ones to take, because if they're not really gluten sensitive and they're fructan sensitive, and eliminating all wheat and wheat products, rye and other barley and other healthy, they're really healthy products, right? With high fiber content and other things. So that might actually affect their health. So it becomes important it takes time, doesn't it?
That's why I call it food detective in my book, because you need to be a food detective it's a process of elimination. That is sometimes it can be, you can identify the triggers in the first week of elimination. Yeah. Some people, it may take a few months or a few weeks to identify. That's why I tell my patients to write down a food diary. So, for example, if there are different diets. Lactose free is one of them, gluten free, FODMAP diet. There are different diets. Whatever diet I recommend, I tell them to write down what kind of symptoms are you having, eliminate the foods, and see what are the symptoms that have improved, and then slowly reintroduce one category of foods at a time. For example, if they go on low FODMAP diet, I tell them just pick one. It can be just onion. Try that and give it a day or two to see if you react to that. Okay. By the way, it has fructan, it doesn't have gluten. So that is one way to differentiate if they have symptoms with the wheat, but if they don't have symptoms with the, onion or garlic, maybe they are gluten sensitive rather than fructose sensitive. So they write down the symptoms and how they react to each category of foods so that they can personalize their diet as they go along. It can be long, but once you identify the triggers, they stay the same most of the time. So it is worth spending that time to identify the triggers so that you can follow it long term.
Yeah, so this is very important because having a food diary gives us a lot more information than most of the tests and scans and things like that, right?
Yeah, because sometimes you don't remember what you ate yesterday unless you write it down.
Right.
If you ask patients, okay, 2 days ago, what did you eat for dinner? It's hard to remember.
Okay.
So if you write down, and let's say if they said that, oh, I had bad bloating yesterday, I can say that, go back and what you ate 2 days ago. See if that correlates with the symptoms and try it again to see if they have symptoms.
Yeah. So on a side note, tell us about onion and garlic. So these are one of the FODMAP diets.
Yes, they are.
Yeah. So I know in certain cultures, such as, I keep going back to Indian culture because I'm more familiar with it. So
yeah,
there are certain groups of people who recommend not for that groups of people who they don't recommend onion, and it looks like there is some kind of understanding from the ancient Ayurvedic physicians who probably recognize that onion has something to do with the gut function, and therefore avoid because for your profession or for your genes or whatever, you are more susceptible to this type of onion and garlic, and therefore avoid it. Of course, it comes under the umbrella of religion, where this type of, like, for example, Brahmins, they tend to avoid garlic, and especially garlic, and sometimes they take onion. Do you think that has something? Cultures have identified the certain types of foods are not bother or irritate the gut, and therefore you avoid it?
I think so. I think they knew a lot more about our gut even hundreds of years ago. So probably there was a reason why certain communities in certain parts of the world avoided certain foods, not because of religion, not because of culture. Maybe they figured out that these are the causes of symptoms, so that's how they eliminated, and it became a tradition. Although whoever started it like 300-400 years ago probably figured that was causing the GI symptoms. Again, until 2005, we didn't know about FODMAP, but people started eliminating garlic and onion hundreds of years ago because that's those have fructans in it. So maybe there is a correlation between avoiding those and relief of GI symptoms.
Yeah. So these cultures, Ayurvedic, Chinese traditional medicine, and so on, they focus highly on types of foods to eat, foods to avoid. For even the timing of the food, timing of certain types of food, even the foods to avoid on, let us say, on weekends or Saturdays or Sundays. So there is a lot of focus on the gut, the types of foods you eat, the timing of the food, the type of person you are, and so on.
Yeah, no, that is true. I think timing is very important. We talk about it all the time. Smaller meals more frequently is always better than 2 or 3 big meals. Eating late at night can cause more GI issues. So I think timing is very important, and the quantity and the quality of the food, obviously.
So we, up until a few decades ago, or a few years ago, we talked about small frequent meals for diabetics and other people. Now we are shifting towards more of an intermittent fasting type of diet. Yeah. So what has that to do with IBS? So do you recommend more frequent meals? Because obviously you are focusing on, obviously you are trying to address IBS, but then you end up with some other health problem like diabetes or some hypertriglyceridemia or hypertension or obesity and so on, while you are addressing one problem. So tell us about how to balance these things. You have IBS, but you also have diabetes. or you have obesity, then how do you, because when we talk about one disease, we focus just on one, because that's how Western medicine works, right? At the exclusion of everything. That's controlled experiment where you control everything. When you say you control everything, you keep it as a constant, like it doesn't happen, but it doesn't work. Human biology, human body is multi-directional. Everything hits at once. Everything is just happening all at a time. So when you talk about IBS, you also have to think about, oh, you have a cardiac disease. So you can eliminate certain diets, or you cannot, take this type of diet. So tell us about how do you handle IBS in the complex human system?
Yeah, no, that's very important point. We cannot focus or have a tunnel vision that, oh, you have IBS, just go on FODMAP diet. What if they have diabetes, if they have heart condition, high blood pressure, kidney problems? There are so many other factors we need to take into consideration. Luckily, IBS affects more younger patients who tend to be healthier, but there are people who were diagnosed with IBS in their 20s and 30s, but they still have it in their 50s, 60s. Now they have other issues like diabetes and all that. That becomes a little bit more complicated. So if I just give them a sheet of the foods to eliminate, they'll say, that leaves me with nothing, because you're telling me not to eat all these foods, like 20 different foods,
and your cardiologist told you to eliminate this, and your endocrinologist told you to eliminate that.
Endocrinologist tells me that because of diabetes you cannot eat all these, so what am I left with? That's where the dietitian comes into the picture. I think we underutilize the dietitian, partly because sometimes insurance may not cover it. There are a lot of barriers. But that's why I think there is delivery gap when we talk about integrated approach, where we need to do it more holistically, including the diet. Dietitian is a very important component of managing IBS. So now going back to the diet, one good thing is, all the low FODMAPs that we recommend are all carbs. So generally people with diabetes, they're already restricting the carbs. They're more on protein and some fats and some healthy carbs that are generally good. But there are certain things, for example, when you go to endocrinologists, they might say more green leafy vegetables. But when it comes to IBS, for example, broccoli, which is supposed to be healthy, it can produce a lot of gas and bloating, discomfort, especially if it is raw vegetables. People equate eating raw vegetables is healthy. It may be healthy, but it's hard on your gut, because harder to digest, you're going to have more symptoms. That's why we need to fine-tune the diet so that it conforms to the diabetic diet, at the same time, follow the low FODMAP diet. Sometimes, especially if they have complicated medical history, I tell them to see a dietitian so that they can guide them through the different diets.
What's the role of fiber in IBS?
Fiber is very important. There are a lot of studies showing that people who consume high fiber diet, before low FODMAP diet, we didn't have much other than, high fiber diet. That was other than lactose free and gluten free, which is, one step higher than just telling them, oh, increase the fiber in your diet. High fiber diet, there are a lot of studies showing that there are benefits, not only in improving the gut health, it improves the gut transit. If you have constipation, it'll help, especially soluble fiber. Okay. If it is insoluble fiber, then you don't digest well and it can cause more problems. So
what about IBS diarrhea type? Do you still recommend fiber and diarrhea?
Even in diarrhea, if they have severe diarrhea, sometimes we do recommend high fiber diet. For constipation predominant symptoms, it's very straightforward. We recommend high fiber diet. Right. When they have diarrhea predominant symptoms, we do recommend eating at least 25 to 35 grams of fiber a day, but don't overdo it. If you have constipation, we might tell them to increase the fiber intake, but people with the diarrhea, just at least adequate amount will help improving the symptoms. And they have other benefits, as you know, it can improve the cardiovascular function, cholesterol, other benefits of fiber. So I strongly recommend that. Yeah. But again, insoluble should be avoided. And anything raw vegetables and salads, try to cut down on those. Cooked vegetables would be better than uncooked vegetables.
So tell us about the raw vegetables, because there is this movement where people are going more towards eating raw foods. Of course, you have to clean it and wash it and things like that. Apart from that, raw food is processed differently than cooked food in the gut, right? So by processing, how our body processes raw food versus cooked food. Of course, our Paleolithic ancestors ate more raw food before the processing happened in human civilization. So tell us about for IBS. How do you balance it? What kind of ratio do you recommend, raw food versus cooked?
I don't recommend raw vegetables in general because they are harder to digest.
Salad?
Because your gut is already sensitive. Okay. So you are putting more stress to the gut because boiled or steamed food is easier to digest than raw vegetable, for example. That's why you want your gut to work less than overwork when it is under stress already. So cooked vegetables are generally better. And the other reason is not only it's easy on the gut, but raw vegetables tend to produce more gas because they're harder to digest. They go through the gut faster without getting digested. And then when gut bacteria acts on them, they produce more gas and bloating. So that's why we generally don't recommend raw vegetables. As far as nutrients, unless they really fry them up and kill all the vegetables, you still get all the nutrients by boiling or steaming them. You still get all the benefits of the nutrients without compromising the nutrient value of the foods. You can cook the vegetables in a way that it's easier on your gut.
This is important because people think that anything raw is healthy for them, but it may be actually hurting their gut because the gut has to work over time to process it. And the gut may not have all the enzymes and things like that to process the raw form of the vegetable. So in this holistic approach to IBS, in this holistic approach to IBS, we touched upon the importance of diet. In fact, we can have an entire series of sessions just on the diet, right?
Yes.
This. So in this diet, we touched upon there are certain types of foods to eliminate. I presume that most of this is available in the book. So the types of you need to avoid certain types of food. And I briefly asked about the role of intermittent fasting in IBS.
So there are not, it's on the rage now. Everybody is trying it. I think there are a lot of benefits, as you know, especially for weight loss, but all other associated benefits with intermittent fasting. I have a lot of patients who are doing intermittent fasting. I don't think it'll hurt your IBS, okay? Because a lot of times when you eat foods, that's when you start having symptoms. You're actually not eating for 18 hours, for example. That'll eliminate a lot of gut stress and gut having to work. So I see improvement in their symptoms when they go on intermittent fasting. There are a lot of benefits. Only thing I tell them is when they have that 6-hour window, don't overdo it. Have 2 meals. Avoid certain things, again, processed sugars, all the sugary drinks and all that. If they are careful with those 2 or 3 meals between that 6-hour period, I think there are benefits in doing intermittent fasting. So there are a lot of benefits.
Yeah. And again, you and I know that time restricted feeding or intermittent fasting comes in different shapes and forms. You can have anywhere from 12-hour fasting window to 4-hour fasting window, right? And then what you eat. In fact, my intuition is that when let us say you do intermittent fasting in a healthy way and you improve your overall health, that improves your sleep, it improves your stress levels, it improves your relationship, social connections, overall health, and then that in turn helps the gut the gut
Absolutely.
brain.
There's no question. Yeah, there are a lot of benefits. Just the way you feel better. That itself will help your gut.
Yeah.
Yeah.
So yeah, let's move on to the other holistic modalities or approaches that you recommend in the book. Tell us a little bit. We don't have like unlimited amount of time here to talk about those things, but at least touch upon those things and direct our readers to where to go, where to find more resources on these.
Yeah. So one of the major components is mind-body therapy. So like I said earlier, when your brain is happy, your mind is happy, your gut is happy. So stress reduction strategies, anything it's called gut-directed therapies, where there are different ones. I'm a strong believer in gut-directed therapies. For example, there are a few different ones. First, let's talk about cognitive behavioral therapy, CBT. That's a very common therapy that is implemented in people, especially if you see a psychologist or a counselor or a therapist. They recommend CBT for anxiety, depression, and various psychological problems, where you identify the negative emotions, you identify them, and you try to move away from those negative emotions. So they talk about the symptoms, what triggers those symptoms. They help you process those symptoms in your brain in a more practical manner so that you can cope with that. So CBT is delivered either in person. Now there are apps. You can do it by telephone, online. So all kinds of different ways to get CBT. So that is one thing. And there is research showing that it helps at least 40 to 50% of people with IBS. But, American College of Gastroenterology in 2021, they came out with the new guidelines for different treatment modalities. They looked at the scientific evidence for each one of them, including the diet, gut-directed psychotherapies, and all that. CBT is one of the recommended treatments, but what they recommend is you need to include it along with other things. You need to include it with diet, maybe medications, but that is one of the components of the therapy. So CBT is one of them. Then there is hypnotherapy. So there is renewed interest, although studies since 1980s showed that hypnotherapy may work for IBS. But as early as more recently, 1980s, there were some studies, but it was not widely adapted. But 2020s and all that, even 2 months ago, April 2023, there was one study showing that hypnotherapy, it's an app called Nerva, NERVA. That is an app where you can get hypnotherapy through the app. And when they studied, 70% of them had relief of IBS symptoms.
Wow.
Many people, they fell off the study. So they had initial response, but keeping up with it is hard. The people may not have the discipline or motivation or financial reasons where you need to keep renewing your subscription or whatever the reason. They fell off the study after 3 months. But while they were on study, 2/3 of them had relief. So hypnotherapy is another good one. And then there is MBSR, which is mindful-based stress reduction. Mindfulness is a meditation technique where, basically it's all about being in the present. You studied integrative therapy, so you know what I'm talking about. So mindfulness-based meditation is very big in treating right from drug addiction to anxiety, depression, a lot of other things. Even in IBS, MBSR, mindful-based stress reduction, not only includes mindfulness meditation, but it also includes yoga. So the combination, again, there are studies showing that it helps IBS. So that is another one. So we talked about CBT, we talked about hypnotherapy, we talked about MBSR. Then there are studies showing just separating yoga or even meditation. There are studies where it showed that these techniques will help reducing IBS symptoms. So when I see my patients, I recommend, other than diet and maybe medications if needed, but I recommend one of these depending on what they can do. For example, if they don't have any stress or anxiety, they just have IBS symptoms, I might recommend just yoga or even exercise. There are a lot of studies. You don't need to do anything fancy like yoga or meditation. Just go and work out. 150 hours per week is what is recommended by American Heart Association. Moderate exercise, 150 hours. You get so many benefits. It's not only health, cardiovascular benefit, metabolic syndrome, all the other stuff, but also it helps reduce the stress. It helps the IBS symptoms too. Again, there is a lot of science behind it. Studies show that it helps the IBS. So I tell them, even if you cannot do CBT, all the fancy stuff, just go work out. It has a lot of benefits. Or if they already have a gym membership, I might tell them, go check out yoga class, or meditation apps are available. Now, if you look at so many apps, there is Calm is one app, Headspace is another app. So these are all meditation apps, very popular. So you just spend 15-20 minutes every day, 3-4 times a week. That'll help your mind and body. So I'm big on this mind-body therapy also.
Yeah. Basically, anything that helps stress reduction. Not everybody have access to all these apps and things like that. People who live in US, people who are more affluent can do it. People who are living in villages and like Uganda or Somalia and things like places like that.
Exactly.
So they can still benefit from taking a walk in the woods. So,
exactly. So exercise or yoga is easy to do. No need for an app. No need for a coach or a teacher. No need for any facility, equipment. There is nothing. Your body, and you can do it. That's all you need.
So that's great. So we talked about diet, mind-body techniques or modalities, and then there are drugs, and then there are complementary or alternative medicines and other things. So very briefly, how are we doing with drugs? The scientific, the Western medicine drugs. Do we have good drugs to handle these, or they're mostly? See, the thing is, I forgot to ask this or mention this earlier on, is there is no cure to it, right? So you can put them in remission by doing these things. It's mostly symptomatic control, but the only way that you can call it cure is by putting them into remission by avoiding certain types of diet and things like that.
Yeah, control of symptoms. It's like, that's what I tell my patients. IBS is a lifelong condition. It's like diabetes or high blood pressure. We cannot cure diabetes, we cannot cure high blood pressure, but we can control it well if you follow certain rules and take certain medications. Same thing with IBS. The good thing about IBS is it never ever kills anyone. It can be very annoying to have it, but it's not life-threatening like diabetes or high blood pressure. That is the good thing about IBS. But it can affect their quality of life and all that. So going back to the medications, there are some good medications for IBS, but I am very selective who I use medications for. So, for example, diet is always the first thing I recommend, especially younger patients who have mild to moderate symptoms. I may not even offer the medication unless they insist on getting medications because they have a lot of abdominal cramping. It's affecting their, school or job. I might give them an antispasmodic. For example, dicyclomine is one of them. So there are antispasmodics. There are certain medications to help with the constipation. They're not just laxative. You can just use laxatives, but there are medications that will improve the gut motility. So going back to the causes, now I'm going back to the beginning of the conversation where we talked about, gut microbiome, altered microbiome. We also talked about, visceral hypersensitivity. And one of the things is disordered motility, where your gut is not the peristalsis of the gut, where the things are moved from one part of the gut to the other part, where there is motility. If it is disordered, it can be too slow or too fast. So there are medications to control the motility. So these are medications are used to people with diarrhea, people with constipation, depending on what kind of symptoms they have predominantly, there are medications we use.
Wonderful.
So there are some over-the-counter medications, some prescription medications.
Prescription medicine. So
yeah,
there's this whole market-driven movement towards probiotics, prebiotics, symbiotics, postbiotics. Tell us about, demystify, declutter, demystify this probiotic, prebiotic, symbiotic, postbiotic. Is it a marketing gimmick or is it real?
No, the problem with probiotics, like any natural products, there is no FDA control in US. I'm talking about US or any drug controlling organization, whether it's UK Drug Council and all that, because there is no control by a government body. Anybody can make any supplement and call it probiotic, prebiotic, postbiotic, all that. But there are studies coming to probiotic. Probiotic is adding good bacteria. The probiotics are good bacteria that you add to your gut. When you have irritable bowel syndrome, there is imbalance between good and bad bacteria. There are studies showing that people with irritable bowel syndrome, there is decreased level of good bacteria, bifidobacteria, lactobacillus, and there is increased bad bacteria, actinobacter and proteobacter and all those. They are higher quantities of bad bacteria. So to improve the balance of good bacteria, by adding probiotics, you're improving the good bacterial count. So logically, it makes sense. And there are studies showing that they work. Only problem is because there is no oversight by FDA, anybody can make any kind of formulation. So it's hard to corroborate the results from one study to another because there are so many different probiotics, different counts, different combinations. That's why it's hard to recommend one probiotic. There is some benefit as long as you take a probiotic in a capsule form, because like I said earlier, probiotics are sensitive to acid. So you need to take a controlled release capsule where the probiotics are protected from gastric acid. You take it. Prebiotic is the food for probiotic. Prebiotic, for example, inulin is one of the sugars, and it helps improve because probiotics feed on the prebiotic. So by combining prebiotic with probiotic, you're improving the probiotic quantity in the gut. Okay, so those are pre and probiotics. And then, there are some, now the new term is psychobiotics. Psychobiotics are probiotics that improve the psychological health, mental health that you take. And there are certain companies that are coming up with this. This is more like a tailored approach where there is now the precision medicine based on your gut microbiome. They recommend certain, depending on what kind of problem you have, what kind of microbiome profile you have, they recommend certain probiotics. Psychobiotics are recommended for people with anxiety and depression. So there are all kinds of names, but the basic idea is you're altering the gut microbiome.
I hope there is adequate research, or at least developing research in that area, because everybody wants to get a piece of the medical marketplace. Everybody.
Yeah.
So that's amazing. So we talked about so many things in this 1 hour 15 minutes, 1 hour, it's about 1 hour 10 minutes or so. There is a lot more information in this almost 300 pages of books. So I would recommend our listeners to please go and get a hold of this book and spend more time on it. It's worth reading more than once, taking notes, especially things like taking a food diary, notes on that, and then going back to your healthcare provider, talking about it, especially talking to your dietitian and things like that. So I'd like to switch gears here and talk about something non-medical that Dr. Sripathi does, which is his athletic side of his, or the physical activity side of his life. So tell us about your expeditions, your adventures, explorations on that side. You talked about going to Mount Everest base camp, about marathons in all 50 states and all 7 continents. And let's start with the Mount Everest base camp. So So tell us about how it started, what you have accomplished, and what is your experience there.
So it was an amazing experience. It is challenging, but a lot of people can do it. Everest Base Camp, usually, it's a 8 to 9 day expedition. It's mostly trekking. It's not like you're climbing up the mountain with all the harnesses.
So you're in the base camp. You're not going steep up.
Yes, to the base camp. It takes about 8 to 9 days. You go up to the altitude of 17,400 feet. So last 2 to 3 days is very hard because you're at that kind of altitude where your oxygen level is so low. Our oxygen saturation was like 75 or 80. We were very short of breath, even changing our clothes.
So how did you get interested in it? Because normal people don't think of going to Mount Everest, right? So how did you? Extraordinary people do that. So how did you think of going? How did you get this idea or interest in somebody?
When you're physically active, when you're in this athletic circuit where you meet people who are accomplished in different things, whether it's cycling, running, expeditions, mountaineering, and all that. I have several friends who inspire me and I inspire them. So we are mutually helping each other achieve our goals. And, some of our friends who are interested in, similar mindset, seek adventure and challenge. So that's how we did the Mount Everest base camp. I'm more of a runner than mountaineer. Okay. Running is my main passion. And then I do cycling, I do trekking and all that. But I am an avid marathoner. Because I run so many marathons, I'm already, physically reasonably fit to try other adventures. So it's easier for me to do other adventures. So if there is a friend who is, planning Mount Everest or Kilimanjaro, I just join them because, I'm already sort of prepared for it. Of course, I need to do extra training to get used to the altitude and all that. But at least physically, I'm in a good shape to do all that. And, life is short. When you are already trained and your body is ready, this is the time to do it. We are not getting any younger. As far as running, I reached 3 milestones. One is, running marathon on all 7 continents, including Antarctica. And the second is I ran 1 marathon in all 50 states of the United States. And 38 of those states, I did it in 52 weeks last year. So I did 38 in 52 weeks. That's one of the fastest to finish 50 states. Some weekends I did a marathon on Saturday, a marathon on Sunday. 2 different states, flew back home and worked Monday. So I finished all 50 states. It was crazy last year. And then I also finished 6 major marathons. So like, tennis Grand Slam, there are 6 majors. Yeah. That includes London, Tokyo, Berlin, New York, all those. Yeah. So
we have Flying Pig in Cincinnati.
That's a very popular one. Actually, a couple of years ago, I registered for it, but it conflicted with another marathon, so I had to cancel. It's a very popular one. I might do that. So that is a good one.
I'm sure you have done Boston Marathon.
Boston is one of the 6 majors. So I finished Boston, New York, Chicago, Berlin, London, and then the 6th one was Tokyo this past March. So this year, Tokyo Marathon, when you finish all 6 majors, you get this 6-star medal. It's called Abbott 6-star medal. So this year's Tokyo Marathon, there were highest number of 6-star finishers, which is a Guinness Book of World Records. So I am part of that group of runners who finished all 6 majors and we got the 6-star medal. So I'm part of the Guinness Book of World Record. It's not my personal Guinness Book of World Record, but I'm part of the record. So I got the Guinness medal and all that.
I think you deserve a personal Guinness record too, because you did the 7 continents, all 50 states, and the 6 majors.
So there are very few people. Yeah, very few people. It's called 7/50/6. 7 continents, 50 states, and 6 majors. There are very few people who have done that. It is not a personal Guinness Book of World Records. There are people who have done it. I'm the second person of Indian origin who has done 7/50/6.
Yeah, that's incredible. Yeah, apart from this very now becoming very popular book, being a gastroenterologist and having had 10 years of successive best physician award in your city and running all these marathons, that's a quite adventurous life. And something
unfortunately, able to do all that. Yeah.
Fortunate to be able to, and your family and everybody must have been part of this journey.
Yes.
Yeah, because one cannot do this without the support of our surrounding, environment.
Absolutely.
People.
Yes.
Yeah, that is amazing. So, thank you so much for spending this time with us, Dr. Sripathi Kethu. We look forward to more such conversation on maybe more focused topics like FODMAP diet and things like that, maybe shorter conversations. And I will leave link to your book in the description below. And I recommend our audience to go get a handle of this book and start improving your life, and also draw inspiration from Dr. Kethu's other passions too. So when I wrote a book on burnout in healthcare. So when we talk about burnout, one of the things that is highly recommended is to go out of your profession, go out of your thing, do something completely different that is totally unrelated, but then eventually they complement, they come together. You'll start seeing that it's all complementing one another. You're helping people, you're helping yourself, and that's how you improve your core, to help others. So thank you so much for spending this time. I look forward to more such conversations.
Thank you so much, Dr. Kurapati. I really enjoyed the conversation.